Hello anatomy colleagues, this is Dr. Alsup and we will be discussing the neurovasculature for the pelvic cavity session. And this will be a shorter video because the bulk of the neurovasculature discussion will be in the next session. But there are some fairly major structures we want to start to familiarize yourself with and also talk a little bit about the lumbar plexus. So we're going to begin with the end of the abdominal aorta. So here is your abdominal aorta here. You can see this is where the superior mesenteric was, inferior mesenteric. So some of those things that we discussed in the gastrointestinal sequence. And it's going to end or bifurcate into the common iliac arteries. You can see that fairly clearly here. So a common iliac artery on this side for sure. And you can see that it's a fairly large in diameter artery, not tremendously different from the aorta, but it's not particularly long because the common iliac arteries bifurcate right around the pelvic brim into the external and internal iliac arteries. And you can see it a bit better here on the left side, so we'll focus on that. So you can see right about here-ish is where it is going to bifurcate. So this is going to be the external iliac artery. And the external iliac is the branch that does not head into the pelvic cavity. So it's going to continue along the pelvic brim towards the lower limb. It'll actually transition right around this region into the femoral artery. It's going to be the dominant supply for the lower limb, and we'll talk more about the branches of the external iliac in more detail during the musculoskeletal portion of the course. The internal iliac is going to be the branch of the common iliac that does travel into the pelvic cavity. So you can see it kind of swooping right down into the pelvic cavity here. So moving more inferiorly, and it will supply structures in the pelvis as well as the gluteal regions. You can't see the external internal iliac veins well. Well, I guess you can see a little bit of the external iliac vein here, but rest assured that those veins will travel with the same named arteries, but you can see the common iliac veins. So here's one here. You can see a bit of one right here, and these will join together, kind of diving deep underneath here, to form the IVC. All right, and we know that IVC is heading up towards the right atrium. Let's talk some nerves. So some nice somatic nerves, not autonomic nerves from the lumbar plexus. Recall that the lumbar plexus is formed from the spinal nerves L1 through L4. It will send the VPRs of L1 to L4, so it'll send various fibers, and those will create more terminal branches as you go. And it also makes sense that if they're derived from L1 and L4, that we would see them in the inferior portions of the abdominal cavity as well as the greater pelvis region. And this is where we're going to focus on locating these, and we may see some of these name branches again closer to their terminal structures in other videos. Again, you can see the bifurcation of the abdominal aorta here just to kind of get some context. Here's a common iliac again. Here's a common iliac artery over here. And also importantly, I want you to see or be able to identify the psoas major muscle, as this is a very important muscle in distinguishing the branches of the lumbar plexus in this region. All right, up first, or the more superior ones, are your iliohypogastric and ilioinguinal nerves. These are both derived from the VPRs of L1, or the VPR of L1. And it's not uncommon for these to share a common trunk, which is what you can see right here. So a common trunk from L1, and then you can see them splitting into the two named branches. The iliohypogastric is going to be the more superior one. So iliohypogastric is going to be this one, whereas the ilioinguinal nerve is the more inferior one, and it's heading towards that inguinal canal region. Genitofemoral, I think, is the easiest to distinguish in my opinion, as it is the only one to pierce the muscle belly of the psoas major muscle. So you can see this nerve piercing through the actual muscle belly, and then it kind of has its branches as it goes on of the genitofemoral. It is a smaller nerve, but the fact that it's the only one that pierces through psoas major makes it distinguishable. The lateral femoral cutaneous nerve is smaller as well, but it is going to be the one that most obviously is running obliquely over the iliacus muscle. This is your iliacus muscle that literally sits on the iliac crest and the ilium region. And it also looks like it's heading towards your anterior superior iliac spine, so that's what makes this one distinguishable. The last two branches of the lumbar plexus are the largest in size and area coverage as well. And you cannot see the obturator nerve in this image, as it's going to be covered here with gonadal vasculature. But the obturator is always going to be medial to the psoas major muscle. The largest branch of the lumbar plexus is the femoral nerve, and it is located lateral and inferior to the psoas major. Now you can see those same nerves on this image here as well, but I just want to focus on the obturator and the femoral nerves for a second. And when looking over here on the patient left side, what is missing that was so dominant in the other image, and which is also present over here on the right? It's the psoas major muscle. It has been removed here on this side. And the fact that it is removed, as well as some of that superficial neurovasculature, you can see that more medially placed obturator nerve right here. You can actually see a little bit of the obturator nerve here as well, even with the psoas major. It's just a little bit different of an angle here. So the obturator nerve is always medial to the psoas major. It's a little bit larger in size than some of the other branches, but it is not as large as the femoral nerve. So you can really see the length and the size of the femoral nerve in this image here. You can even see where it's moving into the lower limb. So right around here is that inguinal canal region, and then we're heading into the lower limb here. So this is the femoral nerve. And it's near the, next to the femoral artery and the femoral vein. This is the artery. This is the vein right here. And really that artery is just a continuation of the external iliac. You can kind of see it. And right at this point here, it transitions into the femoral. And we're going to come back to this region in quite a bit more detail in upcoming sessions. We call this region the femoral triangle, and that's where that femoral artery, nerve, and vein are located. All right, excellent. Great work, everyone. Thank you for your time and attention here. And please always feel free to reach out with any questions.